I'm Andrea Rochon. I'm an advanced practice nurse. I'm currently located in Kingston, Ontario in Canada, where I'm also a PhD student in the School of Nursing at Queen's University. So I'm of the mindset that research and evidence should inform clinical practice. And then to come back full circle, I truly believe that clinical practice should inform the research questions we develop and subsequently investigate. When frontline clinicians are not engaged or involved in research, they may not perceive the results as being important or relevant in their day-to-day work. Furthermore, the volume of evidence from publications, policy, clinical practice guidelines can be overwhelming and prohibitive for a clinician who's trying to navigate the most relevant and pertinent information to inform their practice and the population they serve as they strive to provide safe, quality care and improve patient outcomes. I read a post recently from a physician, and he talked about the fact that if he wanted to stay abreast of all the publications and research pertaining strictly to his specialty, he would spend the vast majority of every month reading, as opposed to actually providing direct patient care. I think this sentiment is felt across the healthcare professions. I know I have seen it in my nursing colleagues who work busy 12-hour shifts, and while they are advocates of evidence-informed practice, they're not necessarily in a position to be reading numerous research articles or leading the implementation of new guidelines. I had the opportunity to review the article entitled, "How do health professionals prioritize clinical areas for implementation of evidence into practice? A cross-sectional qualitative study." So this survey research aimed to identify and also understand various reasons why allied health professionals think that certain areas of healthcare service provision are a high priority for implementation of evidence into practice. And they also identified some of the barriers to making changes, whether an increase or decrease in certain activities in practice. And I think there's relevance across the healthcare system for all healthcare professionals in the information that is reported in this article. So with competing demands and pressures coming from governments, policymakers, organizations, the healthcare systems, management teams, potentially other colleagues or other professions, and then certainly from families, patients, communities potentially, it can be really difficult for clinicians to make those changes and to translate knowledge into implementation of practices. There can be a challenge with resource allocation. So whether it's around health human resources, so not having sufficient numbers of clinicians or not the right skill mix of clinicians to implement various practices, perhaps there's financial implications where there's insufficient funding to make significant changes to practices that are currently occurring in that clinical area. I think that these can all actually be a cause of moral distress for our healthcare providers. Again, I think we all strive and try our very best to do what we can for our patients, the greater good of our patients. There's no question about that. But there can be some limiting factors. And these were identified within this article. So I think this article is the perfect fit for the relaunch of the JBI Evidence Implementation Journal, which will focus on knowledge translation and implementation science. And I think that's really important to help us understand how we are taking the best current evidence, so for example, from systematic reviews, actually implementing those results into our clinical practice. And I think journals like this that can then share that information more widely helps us all to support our practice, to understand effective, efficient ways of implementing those practices. And again, for the greater good of caring for our patients across the globe. So congratulations to the JBI team on the relaunch of this journal, and best of luck with this new endeavor. Thank you so much for allowing me to speak with you today. Take care, everyone.